In this presentation, we will see about the various concepts of prevention. The contents of the presentation includes introduction, the various levels of prevention, and modes of intervention in each level of prevention, and conclusion. The primary goal of prevention is to promote health, to preserve health, and to restore health when it is impaired, and to minimize the suffering which is caused by the disease or distress. What is intervention is any attempt or intervention that has been made in the usual sequence of disease or natural history of disease in man. So the various levels of prevention include primary prevention, secondary prevention, and tertiary prevention. In primary prevention, the modes of intervention are health promotion and specific protection. In secondary prevention, the modes of intervention is we have to diagnose it at the early stages and should do a prompt treatment. And tertiary prevention, in the modes of intervention includes disability limitation and rehabilitation. In primary prevention is the prevention or the action taken prior to the onset of disease. That is, before the disease occurs, whatever things we are doing to prevent the disease that will not occur. So that comes the primary prevention. This prevention mainly we will be concentrating in the pre-pathogenesis stage of the disease. The primary prevention also includes positive health. That is a concept that encourages achievement and maintenance of acceptable level of health so that the people or the individual can lead a socially and economically productive life. So primary prevention also includes positive health, and WHO has recommended primary prevention of chronic diseases by using various strategies. First, primary is the primordial prevention. That is, in this prevention, it is a purest form of primary prevention. In this, we will be preventing the emergence of risk factor itself. So before the development of risk factor, we will prevent the risk factor development in population or in countries. Next is the population or mass strategy. This is directed towards the improvisation in socio-economic, behavioral and lifestyle changes in groups or in masses. High risk strategy is we will concentrate the primary prevention in the groups which are at high risk of developing certain diseases. So only those individuals we will be concentrating. So what is primordial prevention is the prevention of emergence or development of risk factors. That is, before the development, not only the disease but also the risk factor itself we should prevent in countries or in population groups which has not yet appeared, or the risk factor is not yet appeared in that population. We will be preventing it. And what is a risk factor? It is an attribute or exposure which is significantly associated with the development of disease. So there is a difference in causative and risk factor. Here there will be it will be associated with the development of disease. So it is the newer concept where it is the purest form of primary prevention. Examples for primordial prevention is efforts that has been taken to discourage the children from adopting unhealthy lifestyles or practices like smoking, unhealthy eating patterns and harmful lifestyles. The main intervention is through individual or mass education. Secondary prevention is the prevention when we will do, where action will halt the progress of disease. So disease has already happened, so we are going to halt the progress of the disease at the incipient stage, or we will be preventing from further complications. So that gives the secondary prevention. So in secondary prevention, disease has already happened, so we are going to halt the progress or future complications, we are going to prevent it. So what is the aim of secondary prevention is to arrest the disease process, to restore the health which is lost due to unrecognized disease, or which is in the irreversible condition, we are going to change it and reverse the communicability of infectious diseases. So advantages of secondary prevention is high mortality, and we will reduce the mortality and morbidity rate, and the disadvantage are mental anguish, it will cause physical pain, loss of productivity, and it is a little bit expensive compared to primary prevention. What is tertiary prevention is defined as all measures that are available to reduce or limit impairments and disabilities. So in tertiary prevention also, disease has happened, it has progressed to a limit that it is causing some impairment or disability in the individual which has occurred, and we also will try to minimize the suffering which is caused by the existing departure from the good health. So we are going to try to reduce the suffering which is caused by the disease, and we are also going to make or to promote the people to adjust to the irremediable conditions which has happened due to the disease process. And the modes of intervention, coming to the modes of intervention in all levels of prevention. So we have already seen that the modes of intervention in primary prevention is health promotion and specific protection. In secondary prevention, it is early diagnosis and prompt treatment. In tertiary prevention is disability limitation and rehabilitation. So what is health promotion is? It is the process by which we are making the people to understand, or that the health is in their hand and they should increase or try to have control over the health and to improve the health. So it is the process of enabling people to increase control over and to improve the health. So what are all the well-known intervention in this health promotion is health education, the environmental modifications, nutritional interventions, and lifestyle and behavior changes are the few examples of health promotion activities that is followed. So health education can be given to parents, the various groups like parents, or to the whole public, and by the community leaders or by the school teachers to emphasize the importance of health promotion. Examples for environmental modification is improvisation in providing a safe water, improvement in sanitary aspects, and improvement in housing. These are all the few environmental modifications which has been taking place. And nutritional interventions, for example, the vulnerable groups like child and the maternal age group population, the vitamin supplements are provided, and child feeding programs are there, and nutritional education programs to the maternal mothers are given. And lifestyle and behavioral changes, for example, banning of tobacco in the public places. So few examples of then lifestyle modification, wearing seat belt or helmet, so that and all is one of the examples of lifestyle and behavioral changes. Specific protection is altogether to avoid the disease, specific diseases. For that the happenings in specific protection or immunization for certain diseases, chemoprophylaxis, and protection against occupational hazards. So protective equipment, for example, for protection against occupational hazard is wearing protective wears or gadgets is one of the example, and avoidance of allergens, use of specific nutrients, and control of consumer product quality and safety of food and drugs are one of the examples of specific protection methods. So in secondary prevention, early diagnosis and prompt treatment is when the disease has been diagnosed early, then the treatment, when the treatment is given, the prognosis of the disease increases, as well as the prevention of occurrence of the further complication also occurs at this stage. So even though we cannot consider it as a purest form of prevention because disease has already happened, but we are including this in prevention because it is going to interrupt the disease and it is also going to prevent the further complication. That's why it is included in prevention. Coming to tertiary prevention, the modes of intervention is disability limitation. So here we are going to prevent the disease has already progressed, it is caused certain level of impairment in the individual which has happened. So we are going to prevent from impairment stage to handicapping stage. So we are going to prevent the handicapping stage or level in the tertiary level of prevention. So what is impairment is loss of or abnormality of any psychological, physiological or anatomical structure or function in an individual. So what is disability is any restriction or lack of ability to perform certain activity due to the impairment, and it is going to affect the normal life pattern of the individual. And handicapping is disadvantage for a given individual resulting from impairment or disability that limits or prevents the fulfillment of the role that he will be normally playing to lead a socially and economically productive life. So rehabilitation is in a disability limitation. In disability limitation, we are going to prevent from impairment to the handicapping stage. So in rehabilitation it is the combined and coordinated use of medical, social, educational and vocational measures for training and retraining of the individuals to the highest possible level of functioning. So whatever thing which has been lost, we are going to try to give a training or to limit the disabilities which is caused by the loss. So we are going to rehabilitate the function. So the rehabilitation may be medical rehabilitation, vocational rehabilitation and functional rehabilitation. Thank you.